welcome to Balanced Health. I'm Shirley Rose, and this is Joe Costello. So nice that you joined us today. We've all heard of chiropractors giving neck and back adjustments, but what else do they do? And more importantly, do chiropractic treatments really work? Since chiropractic care was founded over 100 years ago, it has been a source of misunderstanding and controversy. Some claim chiropractic care is a cure-all, while others say it's a waste of time and money. But what is the truth? To take the confusion out of chiropractic care and explain how it can be a useful part of a holistic approach to health, we've invited Dr. Terry Smith back with us today. Dr. Smith is a chiropractic physician and certified strength and conditioning specialist who uses chiropractic care along with other tools to help the patients live a balanced, healthier life. Welcome back, and thanks for joining us today.
Thank you, Shirley.
You know, there are plenty of myths when it comes to chiropractic care, so let's kick off today's discussion with debunking the myth. As we grow older, soreness and pain can pop up in most any part of the body. When it comes to pain, many believe that chiropractic care is only good for helping with back pain and is not effective in helping with other treatments. Joe, is this statement true or false? Only for back?
I think it's absolutely false, and I'm even going to throw to Dr. Smith on it. Chiropractic has not only become for back and neck pain. Talk about your work with athletes and talk about your holistic approach to health. What do we mean by holistic? Is it holy?
No. We just mean, all-encompassing, or maybe take a picture at the whole body and all the systems going on at the same time, rather than focusing on just one area and getting kind of lost in what could be causing this problem instead of just looking at where the pain or problem is showing up right now.
So if the idiot light goes on in the car, you don't unplug the idiot light, you find out why it went on.
Try anyways for a little while, right?
So, and one thing I've learned in having you treat me is that if the pain starts here, or if the pain is here, doesn't mean it has anything to do with there. In fact, I saw him a couple weeks ago, Shirley, and my pain was in the very low of my back. Straight across my back and the very low of my back. And he took my head and tried to remove it from my body. And because
but that really feels good, though, when they do that.
Well, it did.
Yeah, it does.
It did.
They stretch you out.
It felt better when he put it back on. But apparently the vertebrae was way up here that was causing the pain way down there. Now, I could have taken a few Advil and, that might have helped manage the pain, but that's not where the pain was coming from.
Well, God gave us pain to tell us something is not right. Something is wrong. It's a signal. And as we get older, yes, we have more aches and pains, but I love what a friend of mine said. She was 85. She went into the doctor and she says, I have pain in my joint. And he said, well, that joint is 85 years old. She said, yeah, but so is the one on the other side, and it's not hurting.
That one's feeling good.
Yeah, and pain is for a purpose. But tell me, how does chiropractic care help? How does it really help with pain?
Define it for us.
Yes.
Define it in its simplest terms. It just means to use your hands. Chiropractic, as a definition, means hands-on therapy, which can mean anything. Whether it be soft tissue, like massaging type work, grinding away at some ligaments, or adjusting the neck or back or elbows. We can adjust any bone in the body. It doesn't have to be just the neck or back. In fact, I think in my practice, because I see so many sports injuries, Joe, I think low back pain is, the least frequent thing I see in my office. I see more shoulders, knees, elbows from sports trauma than just chronic low back pain, which is maybe what we know chiropractors to be the more commonly to treat.
I think that's because that's what other medical professionals refer to them as, that it's good for lower back pain, but it is good for so many other things. I think this would help shed some light to our viewers. A lot of times we have a pain somewhere in a joint or whatever it is, but talk about the relationship of that joint, how it's held by muscle, and how the muscle work is just as important in healing that joint as manipulating the joint.
Yeah, and that's what I think most people don't understand, is that just like when people get heart attack symptoms or whatever, they oftentimes feel something in their left arm or their left face or shoulder area, chest. Same thing in body pains and aches and pains. You can have a sacroiliac joint pain or low back type pain that can refer down the leg or into the groin, and people complain of the groin or leg pain, not so much sometimes the back pain, and that's where I have to go and fix the problem. So there can be this relationship. It's called Hilton's Law, basically. Any muscle that crosses a joint can cause pain to that joint. So if you have
does it pull on it? Does it yank it out of place? How does it cause pain to it?
Because muscles and tissues have a lot of nerve endings that go to them, and those nerve endings tell the joint where it is in space. So how do we know how to catch something or move something? That all these feedback receptors are fed through the muscles and joints and the little receptors inside them. So when someone gets pain in something, it could be caused from a ligament, a tendon, a muscle, a bone, a joint out of place. Something else may be causing it, maybe an organ system that's causing pain to that. So we have to try and figure out what is the cause or the reason for the pain, not just address where the pain is in that person's body.
Well, you know, I have a doctor in the family, my daughter-in-law, and even, you know, just traditionally trained medical doctor, they say, you know, we can't do a lot for lower back pain, so you should go see a chiropractor. I mean, because they really can't do a lot for it. But talking about one area being related to another area, you know, I thought I was having hip problems. I mean, I could see myself in a wheelchair, hip replacements, the whole thing, because I was having so much hip pain. But what my chiropractor told me was that it was my sciatic muscle, which lay beneath the sciatic nerve. And so it actually stemmed to the lower back rather than the actual hip. And that was interesting to me. Is a lot of the problems that we have sciatica or lower back, or is that just one of many?
Well, you can have, that's what I'm trying to say, there's so many, like when people come in and say I have pain here, I automatically start pushing on other places to find out what is generating that pain.
What's
the
the
muscle
source?
was probably the piriformis, if you remember, that was causing, there is no sciatic muscle, I just want to make sure.
Well,
yeah, but
he probably just dumbed it down for me.
The sciatic nerve passes right underneath that piriformis, or sometimes through the piriformis muscle in a lot of people. So if that piriformis muscle goes into spasm, it can compress it, it can touch it. It only takes the pressure of a feather on a nerve to cause that sciatic-like pain. So it doesn't have to be a huge problem, but you can have a lot of pain from it.
And it reveals itself as hip pain.
Hip pain,
so
leg pain, it can be different in every individual because of anatomical differences of where those nerves are related to. So that's our detective work.
Well, Joe mentioned, you know, you stretched his neck, which I think it kind of feels pleasant. Kind of.
Well, it wasn't that neck crack that's cool. It was,
it was
you know, hey, how's it going? How's it? Kids doing it. It was just he kind of ripped his head off of my.
Well, you know, the table that you have is very cool because, you know, they kind of strap you on the top and then they just stretch out your spine. Now, how does that help? And isn't that dangerous?
Let's refer to my case. What were you doing to me?
Okay, I was tractioning out your spine. Basically, the discs sit in between these vertebrae, which is little shock absorbers between the vertebrae. Okay, so think of a sandwich, a bun, something in the middle, another bun. Those buns are the bones, and in the middle is the disc. And sometimes that disc gets just a little bit pushed posteriorly or backwards or anteriorly. But if you apply traction to the two ends of the bone, sometimes that disc will get sucked back in. And almost immediately you will feel relief. So always in chiropractic, when we're looking for stuff, when we do a treatment or do a, you know, trying to fix the problem, you'll know very quickly if you really hit the right spot because the relief can be instantaneous.
That's true.
Someone could come in on a wheelchair and we can basically sometimes, you know, if we get the right thing, they could be walking out without the wheelchair. So it's, I mean, in your case, I mean, it took you 2 treatments, all right? 3, did I hit? One treatment.
It was just one.
Wow. Well, can I talk just a little bit about discs, bulging discs?
Yeah.
I have 2 friends. One is my son-in-law, who's a young man. He's 31 years old. He has a horrible, horrible bulging disc in his neck that he went to the emergency room. He was in so much pain and tears and everything. And he actually couldn't see a neurologist for about 10 days. Because he started going to a chiropractor right away, by the time he got to the neurologist, he didn't have to have surgery. And they said if they'd seen his MRI 10 days sooner, they'd just send him right to surgery. Now, the chiropractor was able to really help him. Is that common? That
is very, very common, actually, that I can help probably about 95% of all disc herniations or blown discs or whatever term you want to call it, protrusion. You know, we can get about 95% of them, whether cervical or lumbar, you know, in the neck or the low back. We can get through traction mechanisms and soft tissue treatments. And if you take a look at MRIs on normal people, people that don't have pain, a lot of times they'll reveal bulging discs that are asymptomatic. You have no pain, but the MRI shows a bulging disc. So if you have someone with pain who goes and gets an MRI and shows a bulging disc, you betcha the neurologists and the surgeons are like, oh my God, this person needs surgery. But that's what their trade is as well.
Sure.
They're trained in going to fix that problem. If that's what they know how to do, that's what they're going to attempt to do.
Now, they said it's the worst one they ever saw without rupturing. What happens if it had ruptured? What do you do then?
So like say, let's use a donut then for a philosophy instead of something else, but the jelly inside of a donut, once it breaks through the side and that jelly starts to ooze down the part of the donut, that's what we call...
Let's talk more about that when we come back,
we will, because I want to ask another question about that. Well, for more information on chiropractic care, go to TLN.com and click on shows and then go to Balanced Health. Or to get a copy of today's show, give us a call at the number on your screen. And up next, do antibiotics work for sinus infections? Very important question. We'll answer that in our Nutrition in the News segment coming up. And Dr. Smith will answer more questions about chiropractic care. We'll be right back. Stay with us.